Hi, everyone. Dr. Adriana Popescu here with you today with my friend Amy Lyon.
Hello, everybody.
We are here because we are the co-hosts for Dr. Glenna Rice's upcoming EMT course that is happening here in the San Francisco Bay Area, October 15th to the 17th. EMT does not mean emergency medical technician or whatever it is. However, I will say that this work has had a profound experience on healing bodies. It's called energetic manual therapy. It was developed as an access consciousness specialty class. Those of you who know access, know access. For those of you who don't know it very well, it is a method of working with people in their bodies. It includes hands-on energy work as well as verbal processing. So I'm a licensed clinical psychologist who specializes in addiction and trauma. I'm also an empowerment coach. But prior to going back to grad school for psychology, I actually trained as a massage therapist. So I do work with people as well with their bodies. And Amy?
Yeah, I'm a certified massage therapist also, and I work with bodies, primarily energy work and body work, also verbal facilitation. And I actually use the techniques that I learned from Glenna's class with all of my clients.
Yeah, and I've worked, although primarily I'm more working in the verbal facilitation arena. I do sometimes, this computer right now is sitting on my massage table. I keep a massage table at my office, and I often will put people on the table to do energy work. And a lot of my clients have different, it's all intertwined, physical, mental, emotional, and spiritual. And a lot of my clients that are struggling with different mental health conditions actually have stuff showing up in their bodies. We somaticize our stress. We lock unresolved trauma and emotions in our bodies. You and I both know you can put your hands on someone's body, doing massage or energy work or whatever, and they'll just burst into tears. All kinds of different things will come up. And I know for myself, having struggled for almost 20 years with Lyme disease and chronic fatigue syndrome, and having had a lot of injuries, a lot of soft tissue injuries to my ligaments, and 5 whiplashes from car accidents. My body's been a wreck, and that's really affected how I feel psychologically.
Wow.
Yeah.
So can you tell me some of what you've experienced with this work?
Yeah. So like me personally, I mean, again, having been a body worker, I've received a lot of different types of body work. And I remember like Rolfing comes to mind. I've had many Rolfing sessions. I did the whole sequence of 10 sessions at least twice, and then was seeing a Rolfer for a year later on. And yeah, it's really powerful work, but it always hurt. And I dreaded going to sessions because it felt like torture to my body. And this, when I discovered this type of, I would say it's energetic myofascial release. That's how I would describe it. I would say that it is so much more gentle and non-forceful. I mean, with Rolfing or even like trigger point therapy, those of you know that, it just feels like we're trying to force that tissue to unwind and release. Whereas with EMT, it feels more like a gentle, like invitation to something different. And it's amazing how, you might be working on like this part of the body, but you feel the effect all the way in like a different part of the body, because the way the fascia works, that's what we're working with in EMT. We're working with the fascia, which covers the bones and the tissue, and the muscles and everything. It's that tissue that surrounds it. So much freedom can come from working with fascia because it's laid across your body in these different sheets. It's really, really fascinating stuff.
Yeah, and it's actually all throughout the entire body, and it's actually one system, and it impacts all the other systems of the body. So like you said, where you're working on one area in your chest, but you're feeling it in your hip or your leg, everything is connected. Nothing is isolated. And that's what makes this so unique. And like you said, with energetic manual therapy, you're meeting the person and their body wherever they're at. So there's no force. There's absolutely no force, and you're meeting whatever barrier is there and being in the question and using body processes to melt those limitations, melt the solidity, melt the judgment, melt the trauma that's
Yeah.
impacted the body. And it
Huge.
changes so much.
Yeah. And, Glenna's got a couple of, there's the introduction class, which is what we're, or the 3-day class, the sort of the basic one we're doing. And then there's this artistry class, which is more advanced for people who've had experience with the intro level EMT class. And so you and I have both taken the artistry class. And can you say a little bit about that? I loved it.
Wow. I mean, I love both the fundamentals, which is the class we're talking about today, and the artistry class is advanced. So in that class, we have more of an ability to have the foundational tools, kind of techniques to use and questions, and you kind of get your feet wet with it. But in the artistry class, you're really you have full permission to just completely experience and dance with the body. So wherever that body leads you, I mean, it's in both classes, actually. I don't really know what the major difference is, other than there's more of a dance with bodies. You're a little more confident now that you've taken the fundamentals class. So it's just really an experience in getting to know how you communicate with bodies, how bodies communicate with you, that you can actually hear the whisper of the body, and you can it will show you where to go. It'll show you where to put your hands. It'll show you what that person requires. I mean, they might tell you, you're working on my chest, but I really need you to work on my hip, and it just opens up your abilities that you may not even know you have with bodies.
Yeah. I mean, and this is not a class just for body workers. That's what I think the misnomer can be. It's like, we all have the capacity to attune to just what Amy is saying, to attune to another body, to follow the energy, follow your knowing. And I just see a lot of lit up faces, when people get so excited, like, wow, I've never worked on bodies before, but I can do it. And the person is telling me they feel amazing. They've like something opened up. They're walking different. They're sitting differently. That pain that was there forever is going away. I mean, really miraculous things have happened. We've seen people's scar tissues, people who've had like cancer and had operations, people who have all kinds. For me with the whiplash, I've had, a number of sessions with Glenna. She really helped, I couldn't even move. Like my range of motion was so limited. Yes, Glenna's a physical therapist, and Amy and I have both done body work, but even in class, just getting the work done. And I remember, I think it was an artistry, right? Maybe we were working inside the mouth, and like how much trauma people have in their mouths from like dentists and lifetimes when we were tortured and whatever. And it's like, it's amazing what information will come to you when you just like put your hands on someone's body and, like you say, dance with it. I mean, truly magic and miracles. Like I've experienced it. I've facilitated sessions for others where that happened. And you don't have to have any training. You don't even actually need any prerequisites for this foundational class.
No prerequisites. And I do have to say that the unwinding that took place for me in these classes, where I actually had a session with you in one of the classes, in the artistry class, and that was the most unwinding my body's ever experienced. And I've taken other classes with other modalities, cranial sacral, other body work, and my body completely responded, and like it changed. It changed everything, that session. So, and I also see it with my clients who come in. Like I had a woman who's come in 4 times. So 4 weeks in a row, she had carpal tunnel, and she can move her hand. She can do her typing. She can do her mouse work. And she has literally, it's gone. It's completely gone. She had a brace that she had to wear. She's like, my body doesn't want the brace on anymore. She's asking questions. She's communicating with her body in a whole new way, which has transformed her whole entire life, not just her physical issue.
Yeah, that's amazing. Yeah, I wish I'd had these tools back when my mom had carpal tunnel surgery. which really did nothing but create more scar tissue and didn't resolve her pain at all. And it's so unfortunate. I think especially, you know, the Western medical model is all about, let's give it a pill or let's cut it open. And we don't have to go to that. You know, if you're someone who has struggled with pain or injury or whatever it is, I think these holistic energy-based methods can be so powerful and actually get to the root of whatever's creating the wonkiness and change it. Whereas, you know, Western medicine, it's more like a Band-Aid, you know, it's not really getting to the root of it. And people don't really understand. I mean, as a psychologist, I don't think people really understand how it's all interwoven together, how the trauma is locked in the body. And you don't necessarily need to talk about trauma to help it heal. You can actually work directly with the body to help invite it to release. And then that affects the psyche, that affects your mood, your anxiety level, your depression level, your trauma reactions, whatever. I've seen that change just from people doing this more nonverbal, you know, energy or somatic based work. So I would not do trauma work without someone with someone without having this option, even as a primarily more of a talk therapist.
Mm-hmm. Mm-hmm. Yeah.
So if people want to find out more, Amy, where can they go?
Dr. Glenna Rice. We'll post it here.
Yeah. drglennarice.com, I believe, /EMT. And it's also posted on the Access Consciousness website. If you search energetic manual therapy or Dr. Glenna Rice, you can also private message either one of us who are posting this, because we are co-hosting it. And the really exciting new thing this year is if you have taken the EMT fundamentals class before, you can actually get a discount on this one. I think we're offering like a $400 discount, which is awesome. Repeat pricing. Yes.
Yeah, absolutely amazing.
Yeah, I can't get enough. Every time there's an EMT class, I want to be there. So
me too.
we hope to see you there. And please know that this is, or be in the question of what gift can this be to me and my body and to the people that I care for, whether it's in a professional or personal capacity. You know, what contribution could learning these techniques offer you and the people you care for? Thanks, everyone.
Bye.